Vitamin B12 supplements, when do you need it and by how much? Who needs it the most? Vitamin B12 plays a significant role in forming red blood cells, maintaining cell metabolism, ensuring smooth nerve functioning, and taking care of our DNA, the basic unit of life. Photo, Getty Images Think Stock. Many patients feel that their vitamin B12 levels have fallen because of viral infection. This is not true. What they fail to realize is that they were deficient in vitamin B12 from before, and when an infection sets in, these low levels dip lower, says Dr. Romel Tikku, Director, Internal Medicine, Max Super Specialty Hospital, Delhi. A lot of my patients are reporting extreme fatigue following a bout of viral fever, be it COVID-19 or the flu. And a lot of them are taking vitamin B12 pills as part of their convalescence. However, taking a supplement may not always work. Your vitamin B12 levels have to be clinically proven to have fallen significantly to warrant supplementation. Otherwise, much of the usual deficiency can be made up for by dietary intervention. And if your levels are normal, a supplement won't work. Many patients feel that their vitamin B12 levels have fallen because of viral infection. This is not true. What they fail to realize is that they were deficient in vitamin B12 from before, and usually nobody tests themselves exclusively for their vitamin levels. So, when an infection sets in, these low levels dip lower. Post-viral, the deficiency symptoms become more overt. The only good part is that vitamin B12 is water-soluble. So, the body will take what it needs, that is if you need it at all, and pass the excess through the urine without causing major damage. On the contrary, vitamin D causes toxicity because it is fat-soluble and remains in your system. Why your body needs vitamin B12? https://images.indianexpress.com/2020/08/1x1.png. Vitamin B12, cobalamin, plays a significant role in forming red blood cells, maintaining cell metabolism, ensuring smooth nerve functioning, and taking care of our DNA, the basic unit of life. Left untreated, vitamin B12 deficiency can lead to anemia, fatigue, muscle weakness, intestinal problems, shortness of breath, hair loss, headaches and backaches, nerve damage, mood disturbances, depression, because it affects serotonin, brain fog, atrophy and dementia. Vitamin B12 deficiency can also increase your homocysteine, amino acid, levels, which thicken and clot the blood. Sometimes the manifestation of deficiencies can be extreme, with patients presenting themselves with conditions like having trouble walking, irritability, and weight loss. In short, a deficiency can affect every organ system. How to get vitamin B12 from your diet? Most people get enough vitamin B12 from a balanced diet. You can get it easily from poultry, meat, fish and dairy products. But plant foods do not contain vitamin B12, so what you need are fortified foods like cereals. WHO needs it, and by how much? The recommended daily amount of vitamin B12 for adults is 2.4 micrograms. Of course, as we age, especially after 60, our stomachs tend to produce less acid, which makes it harder for us to extract vitamin B12 from food. Even vegetarians and vegans may have this problem, as do pregnant and breastfeeding women. That's why this group may need oral supplementation. In fact, 80% of Indians in this group are deficient and develop a host of health complications. In fact, this is the reason that we work on markers of vitamin B12, thyroid, and vitamin D to at least prevent or resolve conditions arising out of their deficiency. How to administer vitamin B12 supplements? Usually, doctors prescribe oral supplements for a month or so. But if your levels are very low, then you may require vitamin B12 injection. 5 injections, twice a week, should take care of the deficit. Then one can carry on with the usual pills. Sometimes, we prescribe folic acid, also called folate or vitamin B9, with vitamin B12 to improve iron levels for anemia. The combination works best for boosting immune functions too. But take folic acid only on the doctor's advice, as taking it arbitrarily might just lead to excess concentrations which might cause them to work at cross purposes. Should I get my vitamin B12 levels checked? Checking is not routine, but you should start checking it once you are 60. Usually, blood tests look for markers of anemia, low levels of vitamin B12, and high levels of homocysteine and methylmalonic acid, MMA. Reading these three together can give us a fairly good idea of how bad our deficiency is. Any contraindications? Excess levels of vitamin B12 may cause gastrointestinal problems such as bloating, diarrhea, and nausea.